Welcome back to the Pathophysiology lecture. This is part 2. In this discussion on cellular injury, we're going to talk about the different types of cellular injury. Manifestations depend on how many and which types of cells are damaged. It can be caused by many different things, including hypoxia, ischemia, chemical injury, infectious injury, immunologic injury, physical damage, and inflammation. With any type of cellular injury, as you have injury or harm to the cell or cellular death, it can affect the tissues that the cells make up, and then subsequently affect the organs and the organism, which is you, the entire body. When we're talking about cellular injury, it's kind of everything we deal with in the disease processes, whether it be traumatic or medical, and everything we deal with, whether you're talking about a CHF patient or a GSW patient or a hypoxic patient, it all comes down to cellular injury at the cellular level. And then, of course, tissue damage, organ system failure, all can occur from that cellular injury. So it's kind of a microcosm of what we see when we're seeing a patient complaining of different symptoms, and we're seeing different signs come up when we do vitals and we do an assessment. Repair may occur with proper treatment. Irreversible injury will lead to cell death, and cell death is followed by necrosis. So a real simple example would be a myocardial infarction, which is a heart attack, right? So we know that with a myocardial infarction, the myocardium, which is the muscular layer around the heart, is ischemic, meaning it's starved of oxygen. Okay, it goes from being ischemic to actually causing injury, and then eventually that injury becomes necrotic, which is an irreversible death. And that's really what the infarction part of myocardial infarction means. The same thing happens with a CVA, a cerebral vascular attack, or a stroke, where you have ischemic, injured tissue, and then eventually necrotic tissue. And once that tissue dies, it's irreversible. So with the MI patient, somebody that's had a heart attack, that tissue death around the myocardium can create a weakened heart and eventually heart failure, and the body will use different compensatory mechanisms to make up for that. So hypoxic injury is the first type of cellular injury we'll talk about, and that can be caused by many different things. All of them result in a hypoxia, or a decreased amount of oxygen making it into the cell. All right, so you could have decreased oxygen in the air. You could be in a hypoxic environment, like if you're high up on top of a mountain, or if you're, in a very deep area, like a deep cave or something. You get different changes in atmospheric pressure, and that can cause a thinner air, is what they call it. They say the air is thin, but it's a decreased amount of oxygen saturation. You could have a loss of hemoglobin function, or displacement of oxygen on the hemoglobin. We know that can happen with carbon monoxide, things like that, and cyanide. They can actually displace oxygen off of the hemoglobin, which is the oxygen-carrying component of the red blood cell. You could have a decreased number of red blood cells. One simple way of having that is being hypovolemic. Of course, if somebody bleeds out, you have a decreased number of red blood cells. You could also have a decreased number of red blood cells through anemia. Iron anemic deficiency. Iron is the part of the hemoglobin that actually carries oxygen. You could have disease of the respiratory or cardiovascular system, just like we talked about with a myocardial infarction. You could have an actual clot, blood clot, or atherosclerosis buildup in the coronary arteries, and that can create an area of the heart where you're not getting good coronary blood flow, meaning you're not going to get a good amount of oxygen to that area. And of course, if somebody's got a respiratory illness, they're not bringing in a good amount of oxygen, such as your COPD or your asthma patient. And of course, you could have a loss of cytochromes. A cytochrome is any number of compounds consisting of heme bonded to a protein. Heme as in from hemoglobin. Cytochromes function as electron transfer agents in many metabolic pathways, especially cellular respiration. So if you had a decreased amount of these cytochromes, you could have a hypoxic injury. So while cells become hypoxic, they start to produce different mediators. Early on, when a cell becomes hypoxic, it'll produce free radicals. It's a pretty dangerous mediator. And oxygen-free radicals are basically oxygen atoms that lose an electron. Okay, and they lose an electron, and then free radical is going around stealing electrons. Okay, they're stealing electrons because they don't have well, if you take chemistry, you'll learn about where an atom wants to sit. It wants to have a certain amount of electrons around it to be stable, and that's why different atoms will bind and create different chemical compounds because of the electrons surrounding that atom. So we don't want to get too much into that because it's a kind of a complicated process. However, just know that these free radicals can cause even worsening damage. Chemical instability causes attacks on other cells and membranes, and that happens from those free radicals that exist from hypoxic injury. So that patient has hypoxic injury to a cell, and then the free radicals that come off of that hypoxic injury or a result of that hypoxic injury then can cause even more damage by attacking other cells and membranes. Moving on from hypoxic injury to another type of cellular injury, chemical injury. So chemical injury is caused by outside chemicals. Makes sense, right? Chemical injury. So some common poisons are cyanide and pesticides. Lead, chronic ingestion, leads to brain injury and neurologic dysfunctioning. We've heard of lead poisoning. Carbon monoxide binds to hemoglobin and prevents adequate oxygenation of tissues. So some of these chemical injuries can actually cause hypoxic injuries as well, such as our cyanide and our carbon monoxide. We also have ethanol, may result in central nervous system depression, hypoventilation, and cardiovascular collapse from ethanol, which is the active ingredient in alcohol. We could also have pharmacologic agents. They produce toxic products when metabolized in the body. Next, we also know that infectious diseases can cause cellular injury. So infectious injury is the next type of cellular injury we'll talk about. It occurs as a result of some sort of invasion from bacteria, from a fungus, from a virus even. And virulence is the measure of that invader's disease-causing ability. So if you look here at this nice chart, you see as you go up in the number, it's more virulent. So Ebola being at the top there, it spreads like wildfire, so to speak. Okay, so think of going viral. When something goes viral on social media, it means everybody's spreading it. That's kind of the same idea as virulence here. And then you have pathogenicity. All right, so a pathogen is something that causes disease. All right, so the pathogenicity is the function of microorganisms' ability to reproduce and cause disease. So the pathogen's ability to reproduce and cause disease is a pathogenicity. So we said one of those invaders that can cause infectious disease is bacteria. And bacteria possesses a capsule that protects them from phagocytes. Phagocytes are those white blood cells that will actually eat, if you will, through phagocytosis, different things within the body, whether it be different parts of cells that have died or invaders, different types of pathogens that try to enter the body. Okay, so that's one of the first things you need to know about bacteria is that it has a capsule that protects it from phagocytes. It also is categorized depending on gram staining. So one of the first things you do when they do in the hospital when you bring in a patient that may have an infection is they draw blood for blood cultures, and they'll do different staining processes and see if it's gram positive or negative type of bacteria, and try to identify exactly what this person is infected with so they can treat them appropriately. Obviously, some things cause more alarm, and that patient needs to be confined, and some things require certain antibiotics to treat them. Bacteria also produces exotoxins or endotoxins. So an exotoxin, here you see, comes out of the cell, while an endotoxin is on the cell wall. Okay, white blood cells release endogenous pyrogens, which cause a fever when bacteria is in the blood. All right, so it's pyrogens that actually cause your core temperature to start to elevate. The body's most common reaction is inflammation. So the inflammatory process goes into play whenever it notices an invader, such as bacteria. And one of the things that happens is pyrogens are released. You get dilation of the blood cell or blood vessels, which will bring down your blood pressure. You also get an increase in your heart rate because of that blood pressure going down, also because of the fever, your body's compensatory mechanisms, and this is all leading us down the road of leading to sepsis, and these are sort of the pathognomic presentations of sepsis as well. The next type of invader we'll talk about is a virus. Viruses, obviously, we know a virus can cause infectious disease as well, which means it can cause an infectious injury. Look at a virus as an intracellular parasite. Just like a parasite needs a host to live, a virus needs a host to live. So without you, the virus won't live. But the problem is, when it's inside of you, when somebody becomes infected by a virus, that virus begins to propagate and try to divide, and it'll actually replicate inside the living cells of you or somebody that's become infected by the virus. The next type of injury we have is an immunologic and inflammation injury. Inflammation is a protective response, and it can be triggered by physical, chemical, or microbiologic agent. And if you look here at this diagram, it kind of tells us about the inflammatory process. All right, so tissue injury is caused by a physical, chemical agent or some sort of pathogen. And so just picture this blood vessel here, and you have like a knife or something sharp just pokes through the skin right near it or into it. All right, so what you're going to first have is you're going to have capillary widening, which makes that blood vessel nice and leaky. Okay, so it's trying to get some of the stuff inside the blood to that damaged area. You'll get increased blood flow to the area, so you might even have a vasodilation. All right, this can produce heat and redness. We know that when somebody has vasodilation, they become flushed, and blood is where we get heat, so it produces heat to a certain area. So just think of, when you smack your elbow on something, if it becomes inflamed, it'll start to get warm and swollen, and that's all because of the capillary leaking, the blood vessel dilation, so on and so forth. Again, increased permeability, so you're going to have fluids start to leak, release into the tissues, and you'll get some swelling, some edema. It's going to attract leukocytes. Okay, leukocytes are white blood cells. You'll get some extravasation of leukocytes to the site of injury. Extravasation means it's leaving the blood vessel. So we talk about extravasation when we're starting an intravenous catheter, an IV line, and if you have extravasation there, it's because you're getting the fluid from the IV bag or from your flush outside of the blood vessel into the tissues. Same idea here, where the blood is leaving the blood vessel and going into the tissues, and specific parts of the blood, in this case, white blood cells, leukocytes. Then eventually you could have a systemic response. A systemic response means the whole body starts to have the same response as that localized area. So a systemic response, you'll have pyrogens and all of that, causing a fever and proliferation of leukocytes, pain. Obviously you have pain to a specific area that becomes inflamed, but you could have pain systemically with a systemic inflammatory response. The systemic inflammatory response is the precursor to sepsis. So again, we talked about immunologic and inflammatory injury, local effects, dilation of the blood vessels, increased vascular permeability. So you're going to get more volume, more nutrients to that injured area. Then systemic effects, your temperature will become elevated. So whenever you see a fever tells you that the inflammatory response is systemic. And the systemic inflammatory response is a precursor to sepsis, just like I said before. All right, you're going to have an increase in white blood cells, and your cellular membrane may be injured in the process. So all of these things go into place for inflammation. Another type of cellular injury can occur from nutritional imbalance. So injurious nutritional imbalances. They include obesity, malnutrition, vitamin or mineral access or deficit. So I know you're familiar with Wernicke's encephalopathy, which can cause brain damage from vitamin B1 deficiency, thiamine deficiency. Okay, and that damage can cause memory loss, ataxia, nystagmus, all kinds of bad things. And that's a vitamin B deficiency that can occur from alcoholism, malnutrition, just not having enough vitamin B in your diet. It could lead to alterations in physical growth, mental, intellectual retardation, and even death. Additionally, you can also have injurious physical agents or conditions. So the physical agents include heat, cold, and radiation. Excessive heat can cause cellular injury and death. Excessive cold, you've heard of frostbite. Frostbite can certainly cause tissue damage, and that tissue damage occurs because of cell damage. That cell damage occurs because it's too cold. And radiation, of course, can cause different types of cellular injury. The degree of cellular injury is determined by the strength of the agent and the length of exposure. So, again, talking about that frostbite patient, the longer they are in a cold temperature, the more frostbite they'll have, but also the colder it is. So if it's negative 50 degrees, it's more likely to cause an increased amount of cellular death and damage than if it was negative 20 degrees, even though both of those sound horrendous. Apoptosis. Apoptosis, you've probably heard of, and if you've taken a biology class at all, it's normal cell death. It's actually programmed within the cell that they're gonna die, and during apoptosis, cells exhibit characteristic nuclear changes, and they die in clusters. Controlled degradation allows their remnants to be taken up and reused. So, remember I talked about phagocytosis? So that can actually happen with the remnants of a dead cell. Okay, so here you have the apoptosis cycle. You have a normal cell, okay, and then it condenses. The membrane starts blebbing, organelles start to disintegrate. Eventually it gets a little bit worse, okay, continues to bleb. Apoptotic bodies form, all right, and then macrophages, through the process of phagocytosis, will start to either take up those different parts of the cell or get rid of them as waste. Even though apoptosis is programmed to occur, it can actually be prematurely activated by pathologic factors, cell injury. Forms of heart failure can cause early apoptosis, death of hepatocytes, or the inhibition of normal function. So if it's not apoptosis, it's an abnormal cell death, okay? An abnormal cell death, necrosis can occur. Result of morphologic changes following cell death. Simple necrosis would be gross and microscopic tissue and cells are recognizable. And derived, cessation necrosis, dry gangrene, fat necrosis, liquefaction necrosis. And none of those sound very good. Of course, we've seen gangrene, we've seen tissue necrosis in the form of, we were just talking about frostbite, and all of those things are bad. We talked about necrosis that can occur from ischemia, hypoxic injury, ischemic myocardium from a myocardial infarction can cause necrosis in the organ, also a stroke. You can also have necrosis to anywhere in your body. It happens to diabetics, their distal neuropathy and poor circulation. They can get gangrenous or necrotic toes, and then eventually their feet, and they might end up getting an amputation, something like that. So this is the end of part 2, pathophysiology, and we talked about different types of cellular injury. Different types of cellular injury stemming from hypoxic injury, infectious injury, chemical injuries, all of these different types of cellular injury. And the idea behind it is that you can look at it from that microcosm level all the way to the macrocosm level of how cellular injury can cause tissue damage and even tissue death, which can cause organ damage and organ death or organ system failure, and eventually injury, damage, death to the entire organism, which is the human body.